Hi, I'm Prateek, and in this video we're going to learn a little bit more about fibroepithelial polyps in the oral cavity. Remember, if you want thorough revision notes, exam cheat sheets, CPD, along with a huge bank of exam-style questions and guidelines, head over to ExamineDental.com. We also have expert one-to-one mentoring sessions in order to help you ace those interviews and exams. Fibroepithelial polyps, or FEPs, are benign, slow-growing mucosal swellings found within the oral cavity. They're typically caused by chronic irritation or trauma to an area, and this causes overgrowth of fibrous connective tissue. They're an incredibly common benign lesion found within the oral cavity, and a lot of patients won't even realise that they've got them. There are some classic features in the clinical presentation that will help you identify a fibroepithelial polyp. They are usually well-defined and mucosa-coloured lumps. They may be firm or soft in texture depending on whether they've been recently traumatised. They may also be pedunculated, i.e. they have a little stalk attaching them to the underlying mucosa, or they could be sessile, where they're continuous with the underlying mucosa. Generally, they'll be asymptomatic lumps unless they become traumatised by the patient, and the classic way that they're traumatised is within the occlusion. Very rarely they may be ulcerated if the patient has been catching the polyp. Most common areas that a polyp may be seen are on the buccal mucosa, the labial mucosa, and the lateral borders of the tongue. These are the classic areas where if you're chewing, you may catch the soft tissues. The diagnosis of a polyp is typically done through the clinical examination and the history that the patient presents with. Usually the patient will have a classic history of catching an area of soft tissue in their mouth. This, along with the clinical features that you see, should be sufficient to diagnose a polyp. Patients may also have a history of parafunctional habits. Again, this makes it more likely that they're going to catch the soft tissues, the buccal mucosa and the lateral aspects of the tongue. The ultimate diagnosis of a polyp will be done through excisional biopsy and examination under a microscope. If we consider the histology of a polyp, we will typically find an overgrowth of mature fibrous connective tissue. This is then usually covered by a layer of hyperkeratinized stratified squamous epithelium. There may also be a degree of ulceration present if the area has been traumatized. Along with this, there may be varying levels of blood vessels and inflammatory cells within the lesion. If we're considering the management of a polyp, some patients will not want any treatment to be carried out. These lumps may be asymptomatic and they may never be aware of them. They're typically an incidental finding by the dentist. However, if a patient does want management of the polyp, usually there are two aspects to this. The first one is to remove the polyp, and this is typically through a local anaesthetic excisional biopsy. The other aspect of management, however, is to remove the cause of the polyp. So, for example, if the patient has a sharp tooth or they have parafunctional habits, we need to manage these underlying causes to prevent recurrence of the polyp. Polyps as a lesion do not recur. However, if the cause of the polyp is not removed, then new polyps may form. So in this video, we've looked at fibroepithelial polyps in the oral cavity. We've learned a little bit more about the classic presentation of polyps, how we diagnose them, and how we manage them. Along with this, we've touched a little bit on the histology of polyps. As always, remember to head over to ExamineDental.com, where you'll find a thorough revision note and exam-style cheat sheet on this topic. You can also check out lots of other revision notes over on the platform. I hope you found this video useful. Again, please make sure to like, comment and subscribe if you did. Until the next video, take care.